It can make a singer go silent and keep a boy from growing tall. Stress. On Radiolab. Listen wherever you get podcasts.
I'm Melissa Harris Perry, and this is The Takeaway. Over the past 2 years, we've heard of cats and dogs, our pets at home, being infected by the coronavirus. There's even been news stories of some zoo animals. But an analysis by Penn State and Iowa researchers found that the COVID-19 virus may be fairly widespread among white-tailed deer. Up to 80% of the deer sampled in Iowa from April 2020 through January 2021 were infected with COVID-19. And the U.S. Department of Agriculture has confirmed COVID infections in deer in at least 15 states. These findings worry experts about the possibility for the virus to mutate in wild animals and cause other variants. Here to talk more about this research is Suresh Kuchipudi, who led the research team and is a professor and chair in emerging infectious diseases at Penn State University. Thanks for joining us, Suresh.
Hi, Melissa. Thanks for having me.
Okay, what led you to test the deer for COVID?
Yeah, so Melissa, we at the Penn State University and our collaborators are interested in investigating the susceptibility of animals to COVID virus. And as we were exploring this, there are several indications that pointed to the fact that deer are susceptible. It is based on computational studies and experimental studies. And USD also provided a proof of antibody evidence of exposure of wild white-tailed deer in 4 different states of the US. So therefore, we partnered with the Department of Natural Resource at Iowa and leveraging their ongoing chronic wasting disease surveillance program, we investigated the exposure of deer in Iowa for SARS coronavirus 2.
Now, when deer are COVID positive, are they symptomatic?
Yeah, that's a great question. So we need to understand that when we say COVID, we're actually talking about the disease. So the coronavirus disease is the outcome of infection of SARS-CoV-2 in humans. So what we have found so far is the infection of animals with the SARS coronavirus 2. And there are 2 experimental studies that were conducted with the deer. And so far, our understanding is that when deer get infected with the SARS coronavirus 2, they remain largely asymptomatic. They do not show any significant clinical signs.
Okay, so would that suggest, and I just want to stick with the possibility that we care about deer lives themselves, right? Even before we ask about the relevance for human health. But if deer are able to be positive without being symptomatic, does that suggest that having this infection is basically irrelevant for deer populations? Or is it that we just haven't yet seen what the relevance might mean for deer populations?
Yeah, it certainly is relevant to the deer population. So what it means is that our understanding is limited. So we need to remind ourselves that when experimental studies are done, these are done with a small number of animals and healthy animals. And these studies were also conducted with the earlier versions of the SARS coronavirus 2. So whether the recent variants do any different clinical symptoms in deer or deer in the wild settings that may be having a different aspects such as old age or underlying other conditions or stress or starving. In such circumstances, if the deer may or may not show any symptoms, right? So that part is currently unknown. So it's safe to say we do not fully understand whether or not this is relevant to deer health. It could be, and therefore it needs further investigation.
Okay, let's talk about what it means for potential human health, knowing that deer are able to be and are apparently have these high infection rates.
So currently, the major source of infection of SARS coronavirus 2 to humans is another infected human being. But in the medium to long term, if there is an animal reservoir or reservoirs that will allow the virus to continue to circulate, then it could potentially result in the virus evolution independent of human population, and novel variants might emerge. So while there is no or maybe limited risk of exposure from deer to humans, at least right now, because humans don't normally come in close contact with deer, and there is already widespread circulation of virus in humans. But the main concern is that if we let this virus circulate unmonitored, and that could result in emergence of novel variants down the road.
Now, is this an indication that we should not be eating deer, or is there any reason to think that's a route of transmission?
So the SARS coronavirus 2 is very fragile. So when anything is cooked, the virus gets destroyed. So there is no risk if a deer meat or any contaminated meat is properly cooked. I think the foodborne transmission of the virus is not a major risk. The main thing is the risk is with the people who might be handling deer after hunting or processing. And that's where perhaps there is risk, but not through eating the meat of the deer.
Obviously, what you are is a researcher, and so you may not be able to respond to this one perfectly fine if you can't. But so if someone is a hunter and is field dressing deer and obviously dealing with them in that circumstance uncooked, is there a protocol that hunters ought to be using?
Yeah. So Melissa, before this discovery of SARS coronavirus 2 in deer, in general, any wild animal species, when people interact, there is always a risk of disease transmission. So hunters should already be aware of other diseases that might come from deer, and therefore they should be wearing some personal protective equipment like gloves when they process the meat. So some of the diseases like chronic wasting disease or tuberculosis in some parts of the country. In addition to that, now we also know that some of the deer in many locations are also infected with SARS coronavirus 2. It is a further reminder to continue to follow the recommendations that they have. And if necessary, when somebody is processing the meat very closely, it's also a good idea to wear a respiratory protection like a mask.
Now, what about other wild animals? What about squirrels or raccoons? Those that are quite common. Any reason or any evidence about the possibility that those wild animals may also be carrying COVID?
Yeah, Melissa, that's an excellent question and something that we keep wondering as well. So our understanding of the transmission networks of the virus in the wild. So the question is, deer are getting infected, and who else are they giving it to? And that part is currently largely unknown. And there is a possibility that many of these peri-domestic animals that you mentioned, rodents like mice or skunks or raccoons, they have been shown to be susceptible experimentally. So therefore, in the wild settings, when these animals do interact, there is always a possibility of virus transmission between and among these animal species. But that part is currently unknown, and that is something that also is a significant aspect that needs to be explored.
Suresh Kuchipudi, professor and chair in emerging infectious diseases at Penn State University. Thanks for being here.
Yeah, thanks for having me, Melissa.
This week on The Experiment, Atlantic editor Dan Engber has spent months with rehab engineer James Sulzer.
I went into this to build devices to help people, but I never considered that building devices might not be the answer.
Now he tinkers away, trying to help his daughter Livy regain brain function.
It's really easy as a scientist to poo-poo everything and be skeptical. But as a parent, you need to have some optimism and you need to have leaps of faith.
Listen to The Experiment wherever you get podcasts.